So you've been hearing from physician, so I'm going to give you kind of the nurse's perspective. A lot of times I'm left helping you navigate the nuts and bolts of what's going on. So you've spent a couple years sometimes getting the diagnosis, you've heard all this information from the doctor, and you may feel like you're just entering the maze or you're somewhere lost in the maze. And my job is to get you out of the maze where you need to be. So a lot of times I'm going to kind of focus on the oral and the sub-Q. So we're going to recommend a treatment to you, and it's pills, and it's really easy. You're going to take this at home, but we've also told you it's really expensive. So the first thing that's my job is to get a prior authorization. This is getting permission from your insurance company so that we can give you the drug. So this is our responsibility, not your responsibility. So in the office, it might be the nurse, it might be the social worker, or a medical assistant, other staff member, or even somebody outside the office that works at the specialty pharmacy. People fall into three categories. You either have commercial insurance, you have Medicare, or you're on Medicaid. So with commercial insurance, copay is the biggest concern. It's really hard for me to predict what your copay is going to be, so usually we run a test clip. That's going to tell us two things: if you need a prior authorization, which is about 90% of the time, and then what your copay is. Generally with commercial insurance, your copay is going to be the same amount every month. One option that you do have from some of the drug companies is a copay card. They will either minimize your copay or you will have a zero copay. And those are like heaven sent for nurses. There are also drug company financial assistance programs. Sometimes we'll use a drug off-label, not the way that it's intended to be used, and we can get you free drug or reduced price drug from the company that actually makes it. And then there are copay foundations, which I'll talk about in a little bit. If you are Medicare, your copay is a little bit more unpredictable because of the donut hole, and then generally our medicines are top tier copay. So in January, their fiscal year resets every year. Your first, whatever, if your prescription is covered, and then you go into this donut hole. So in January, I've seen people have copays as much as $5,552, and it just makes you want to faint. This year's been particularly difficult financially, but I think we've got a lot of the kinks worked out. But even after you go through the donut hole and you're in this top tier copay, the copays can still be $1,500 or $2,000 a month. And over 12 months, and if you're on a medication for a couple of years, that's a lot of money. So what we look at is we look at the copay foundations. There's a number of different copay foundations. Some are very easy to enroll, some are a little more challenging. They all have a different benefits. And then there is drug company programs where we can get you free medication. Medicaid generally is pretty easy. You're on there because you don't have a lot of assets. Generally, you get a prior authorization and then can get you the prescription for very little money. Then we enlist the help of a specialty pharmacy. A lot of times people are maybe familiar with Express Scripts or CVS. Those are just kind of general maintenance medications pharmacies. You may think that you need to use their prescription pharmacy, but there are some specialty pharmacies that really emphasize customer care. They take such good care of me, they take such good care of you. They have special services. They have, a lot of them have 24/7 on-call services where you're talking to a nurse or a pharmacist. They will call you and ask you about side effects. Are you taking the medication? They have education. They will make sure you get your next prescription on time. And some of the specialties have people that are full-time dedicated to making sure that they find you help with your copay. These are my favorite, my 4 favorite specialty pharmacies. Not that I'm plugging any one more than the other, but they all have that financial component. And if they are not able to fill your prescription for you, they will direct you toward one. They're very quick. They're very concerned about getting you the medication and getting it to you in a timely manner. So when we're talking about taking your oral medication and getting it to you in a cost-effective, I'm going to actually go back, I'm sorry. So how long does this process take? So you come in the office and the physician says, I want to start you on an oral medication. We get the prescription. I come in and I start spouting off, we have plan A, we have plan B, we have plan C, and you look at me like I have two heads. And that's okay, because sometimes I do have two heads. And I generally will tell you, I'm going to send your prescription somewhere, and if they call you, accept the phone call. So, and a lot of this we do just behind the scenes. The prior authorization can take anywhere from 10 minutes to 15 days. Usually we can get it expedited to about 72 hours. And then we go to the next step, which is getting it to the pharmacy and getting the copay assistance. Some of the copay assistance programs are very quick. We can enroll online. I can enroll you. The pharmacy can enroll you. You can self-enroll. The benefit to some of that is that they will pay upfront so that you don't have to do cash out of pocket and then worry about reimbursement later. The pharmacy just bills them directly, and then the drug comes. And some of them will have a certain amount of money that they will give you. Commonly, there's a $10,000 to $12,000 benefit. If you reach that benefit allotment, then we call them and ask for additional money. Sometimes I can get additional money, and sometimes I can't. If we can't get additional money, then we try and enroll you into one of the free drug programs. The importance to getting you medicine at a price that you can afford goes to compliance. Compliance is taking your medicine exactly the way your doctor told you to take it. If he tells you to take 6 pills every single day, you need to take 6 pills every single day. I've had some patients who've been able to, by hook or by crook, take 48 weeks of medicine and make it stretch 52 weeks. Sometimes that's okay, and sometimes that's really not in your best interest. So if we can bring the cost down to a minimum level, then you can take it as prescribed, not have gaps where I take it for a month. Well, then I don't have it for a week because I don't have the money to pay for it. Or people don't take it at all. So some of the medicines, when they look at it, how many times do patients fill their prescriptions? There's a very high drop-off rate after about 3 months. In our office, we've had some people taking some of these oral medications for 5 years or more. So we're really good at getting medications